At this point, we've already discussed cataract surgery. You know you're going to have some cataract surgery. There are two choices. The first choice is the lens that is paid for by insurance. There is another lens selection which is not paid for by insurance. This is called a premium intraocular lens implant. The standard lens gives us good distance focus, and with that and a small fine-tuning with glasses if necessary, you can see good in the distance, but you won't be able to read. If you want the ability to be able to see far and near all at the same time, that requires a very special implant. Over the past 12 years, I've been putting in all the different types of implants that have been invented to achieve this goal. So I've seen everything that's been in the marketplace. We've had some very good success with these. The most recent success has allowed about 80% of my patients to be 100% eyeglass free. 20% of my patients have been 80% eyeglass free. And they're quite happy with this result. These premium lenses, however, as I mentioned, they're not paid for by insurance and they do cost extra. They allow us to see good in the distance as well as read. The intermediate takes a little while for that to gel, but the intermediate does come in. If the intermediate doesn't come in and you want to use a computer, you just bring it a little bit closer and that should be fine. But I want to impress upon you that the premium lenses do allow you the most freedom of anything from glasses. Now, there is no perfect lens. The natural lens you have, typically you needed glasses for far and for close-up vision. They also developed cataracts. We have to take the natural lens out. The standard lens, as I mentioned, is good, but it's only for distance. So these lenses are our current best attempt to give you freedom from eyeglasses. As we were talking about the multifocal lenses, we basically talk about how they function. They allow you to see both distance and near, as well as intermediate. The intermediate vision may take some time to actually come to fruition before you can use it with any degree of ease. If you have trouble with your computer, you can move it a little bit closer, and that will work greatly to allow you to see in that distance. The standard implant, you can see far away, and you will need glasses to read. The multifocal, you won't need glasses to read. The multifocal functions because it's made of a series of rings. If you were to drop a pebble in a pond, it would make a series of ripples. And that's almost what this lens looks like, with circles going outward toward the exterior part. Each one of these rings will create a focus, but at nighttime, it will create a little bit of a halo effect. The halo effect is typically not too bad in the beginning, but it actually gets better. Over the course of 6 months, most people say the halos virtually disappear. The majority of the patients in the first 3 or 4 months don't even get bothered that much by the halos because I have to ask them if they experience the halos.